good activity. My name is Magda Rosenmöller. I work in the Business School together with Laetitia. I'll make a quick introduction and then we will proceed. So we were asked to do, when we were here this morning, we heard that there is a lot of fantastic results that we have, but very often they're not taken into reality. And to take that we need to work with community, with stakeholders, and many of you do in your project. Sylvain, est-ce que je peux avoir ton attention, Sylvain? Merci. Okay. I thought I'd say this once for everyone, and then you can, afterwards, I'll let you talk, and you tell work. We let you do work. So the idea was to look into what are different stakeholders do. And we made the group that you are with little stories that you have as diverse as possible. So it's not the usual nutrition, mental health, sexual reproductive health. We try to mix as much as possible, and the story you might have might not be the one that you are usually work on, but this is just a basis for exchanging ideas. So with the help of Laetitia and the team, we have prepared the session also with the stakeholder group. We had several discussions with them. Thanks actually to all of those that have contributed to the stakeholder group. So here, the objective is to see what are we already doing well. No? So I come from last week I was at a conference of the EDCGP in Kigali, and Master Tana, who many of you know here, he said, don't use capacity building, use capacity enhancing or capacity strengthening. And that's what we want to do in a peer-to-peer work here. Like seeing what works well in what you do, apply to the case study you have on the table, and try around that to exchange good practices. That's exactly the idea of that we jointly develop some more insights on how we can make the great results really turning them into great outcomes. That's kind of mainly what we do. So identify shareable practices, see what are challenges, and see what would be, for this particular case study you have done, what would be consensus, what would be a way forward. So you have different personas, different people, different stakeholders, and try to put yourself as a team in the shoes of that stakeholder. So, and then what we try to get is seeing what are good practices, first elements of scalable and transferable tools, and see how can we share this across the ARISE network between the ARISE Nutrient project we work on and also the Dutch project. So our work is mainly with nutrition in the ARISE Nutrient project, in the Youth Commission project, but this exercise we thought would be so interesting that we do it all together because we can learn so much across the two projects. So what we will develop here will serve us in nutrition, but we'll get to share with all of you, because these are your ideas and your results with all of you, and that will be actually taken up more formally into the deliverable. But what I really would like to come out of here is a very good recommendation on what can we do, ideas on how can we practically take on the realization of the different results that we have obtained in the implementation studies that we do, or in the intervention studies. Like normally we had foreseen 2 hours, we won't do 2 hours, don't worry. We have been trying to reduce it into 1 hour, so we will do the first part half an hour. We would like you to really try to understand the stakeholder that you work with, and then see what are around the issue that you have in your case study would be ideas. And table 3 is already miles ahead. They have already started earlier working on their persona. So you would start by reading the persona of the story, the setting, the little mini case study that we have developed, and then identify practices, and then after half an hour we will kind of make a quick check if everything is okay, and then ask you to pass on to really draft solution based on the discussion that we had. Originally, with more time, we had foreseen also to do some exchange between the groups, but as we are now, we will be doing it at the table, this exchange. We are a very diverse group of people. We have tried to mix the different, as you probably have noticed, the different geographical locations. We have tried to have some good gender balance and also some good balance between seniority, between experience and younger. We have some wonderful students with us that you have been working with yesterday also. And so how can we actually get, that is the aim of implementing the results that we have to have effective and sustainable adolescence intervention. So this is the part one, meet the persona, understand the real world stakeholders. I will put up this slide in a moment again, so you can actually start, those that want to start working and you have it as reference. Then we have part two. This is the different group works. Laetitia has prepared some, you can use the flip charts. We have been able to organize a few flip charts. There are markers on the table, but we also prepared a paper, so you can also fill it out in paper if that is easy for you. We had assigned some of the senior PIs as a table captain. I would like now, as you sit there, decide who you would like to have as a table captain, and then together you decide who is the one that makes sure that all the notes are being taken. Either you put them on the flip chart or you write them in the leaflet, whatever, but I would like to have one person at each table that is the one that takes notes, that is a different one from the table captain. So this would be the persona. These are the different case studies that you will find, so they're all very different. We have the first one on mental health, then we have some on nutrition, and then on sexual reproductive health. We have been developing this case study in close collaboration with the working group, with the special thematic working groups. So we had several sessions where we said, what is the main, what is your intervention about, what is the main thing? But now you are mixed, you not necessarily work on the one you know, but it's a way of exchanging. So this would be, we would have about, I would say, 5-10 minutes getting to know what is the setting, what is the role of the stakeholder that you put yourself, your shoes in, what is this stakeholder aiming at, what is the stakeholder interest, and how will the intervention that is proposed change, and how will they interact with this intervention, and how will they make this intervention happen. So just understanding the setting, 5 or 10 minutes, and then 20 minutes really trying to see what are the key challenges, what are the pain points, what am I as a stakeholder, put yourself in those shoes, what do I want to have out of it? Is it really what this intervention is proposing me, or is it something different? And then we will, after you have these challenge opportunities and challenges developed, then we will make, that would be, I'm looking at in about half an hour from now, we will make a little check-in, and I will go around and check with everyone anyway. And then we will go to the second step, where we're really seeing what type of solution can we prepare, and what does this stakeholder need, and what could we, as we want to put forward or push forward or foster our intervention, what we can do about it. Any questions? Seems clear. Everyone is reading and starting to work. Fantastic. So I will go around. If you have questions, Laetitia is here, Tiva is here, I'm here, and I will go and just check with you that we have a table captain and we have a note taker, and I wish you a lot of fun. I hope it will be a lot of fun. Let's go. work on that case studies. And now, but you just say, urge having a different part, go ahead, for people, discuss around and work on it. Time check, you should be already now very familiar with the setting, the people. You have decided the case study that you, or the way you want to use this case study. And now we have another 10 minutes or 15 minutes to look into the challenges. What are the challenges? What are the opportunities? What are practical things about? I'll let you do, and I come around again. Thank you. Okay, just checking in with you. I see there's a lot of fantastic ideas sparking. We would pass on now to, if you can, to the second round of really drafting a concrete solution. One or two concrete actions to be taken with that particular stakeholder based on the analysis you did so far. It can be one, it can be two, whatever you will find. And we will give it. We were aiming at finalizing at 6 o'clock because we all had a long day, meaning we will have another half an hour together. 20 minutes work, and then I will ask each group to present 3 bullet points, just to pitch. 1, 2, 3 ideas on what came out, and then we will call it a day. Okay? So I wish you very productive and creative next 20 minutes, and then we will, each table will report a few points. Thank you.
having being critical to be taught in school, then we can have now creative arts in regarding to the mental health issues, and the students themselves, they can draw the comics in the mental health area, and it can be easy to educate them in that problem of mental health, including stigma and other issues. And another thing, we know that in most of the African countries, including my country, Tanzania, we have community health workers. The structure is already there. There are community health workers, especially in the previous years, they were talking about female circumcision and something like that, and they are still there. Some of them are employed by the government, and some of them they are trained, they are still working by the villages. That we can use that as also an opportunity to use them to train both in school and out of school children regarding to the mental health problem that is, as we know that the international organization will help us in ensuring it will be implemented. And if we use community workers, there will also be an element of sustainability, because these community workers, they are already there. They will be now get enough knowledge about the mental health, and then the process will continue. Thank you.
Thank you, thank you. So this sounds, yeah. Seems to be, the idea was interesting to also the World Bank, so that the discussion that we had, to make it maybe a little bit larger, more, and to give him more something to report back, to World Bank or whatever. Fantastic. We have group number 2 now, and this is actually this. Yeah, well done. This is the group. It's a small group. They were very brave to say the 2. They got some support of a mental health expert, so they're strong now. And this is actually where we almost more or less identify with, because this is the group of the senior researchers, and what is interest of the senior researchers. So a few bullet points. Go ahead. Maybe you stand up, then people can see you.
We have the adolescent and young people themselves as one of the stakeholders that we need to map. We also identify families as well. And then we identify state actors from government agencies. So we have the Ministry of Health, Ministry of Education, Ministry of Youth, Ministry of Sports, Ministry of Information and Communication, Ministry of Employment, and we have Ministry of Gender as well. Then we have civil society organizations like NGOs working in youth mental development, NGOs working in youth development, and then youth use and social media influencers. Then we have religious bodies, both Muslim, Christians, and other religious bodies as well. And then we have the media itself, so the media also as one of the stakeholders that we need to map as well. And then for solutions, we said we need to do strategic advocacy engagement. So our seminar is strategic about engaging the various stakeholders or the right stakeholders involved to bring them around the table again to have solution engagement. And also to lobby with digital platforms to provide and also to consider investment in youth mental health as their programs. And then we also have mobilization of media and social media influencers to also shape public opinion and increase demand for mental health. And I think the last one is to do stakeholder mapping and engagement. In particular, religious bodies, policy makers, and school management. Thank you.
Very good, thanks a lot. I was saying that you really have worked on what the minister told us today, that the research, the academic need to reach out to the politicians, they need to look for them. And you also said you want to reach out to the media. We have a media table here at 10 and they will answer to you on what they will do about it. So, very well done. We continue with group number 1. You ready? Oh, you want to move it on first, or? Okay, well, table number 1 is the minister. So this is one of the important stakeholders. And let's see what they say in order to take on a program, and this one is on mental health. So give us your ideas. What would a minister expect from, beside what we heard today from the Health Commissioner from Lagos, and say, come see me, but when you see them, they don't usually have time. So tell us, what should we do?
Okay, thank you very much. So I'm speaking on behalf of the Minister of Health. Okay, so because the role of a minister is also a political space, some of the challenges I anticipate in this project are full financial commitment. For this project am I expected to commit fully to it? You know, given that we've also committed to we have other projects we are on to right now, then how do we measure the health outcomes of this project? Okay. Then also budget provisions. We already have a government structure on ground, and we have expectations from the higher authorities, the president in this case. So how do we manage it alongside with already provided structures? Okay. Then I'm also considering acceptability alongside projected reach. So now to solve some of these problems, first of all, a very, very key approach is having a health impact matrix. So the health impact matrix will be to measure the outcome, okay, to measure the outcome of this intervention, okay, then also to know the expected reach, to know the project reach, and then also to, as a minister, I want the mental health literacy improvement framework, which will come alongside this project. Then I'm also expecting a reduced burden on clinical mental health services. So for the stakeholders, first of all, to engage the stakeholders successfully, we want to start by mapping out the stakeholders. In this case, we want to include the Ministry of Education as well. We want to include the school health units, the school health units, then the Ministry of Youth and Adolescent, so the youth-led organizations within the country, then local publishing partners and then community leaders, which is the level at which this intervention will be taking place. And then
a lot of things that the minister wants,
So also to ensure sustainability, I think it would be better if the ministry is partnering with other organizations rather than committing fully to this. It's better if the ministry is partnering rather than taking up full financial commitment to this project. So partnering is key. So I also want to identify the partners. So who are the partners in this case that we are working with? Perhaps international bodies, private organizations as well.
So for that, you should be talking with Table 3, no? You should now get together and they said, hey, guys from the World Bank, we would like to get some funds, no, for making a particular intervention. Last word before we move on? Mr. Minister?
So
I think the last thing I would want is to establish a multi-sectoral committee. Let's look at all of this in detail so that we know who is responsible for what and which, and then know where I'm coming in and how this will also further my political agenda. Thank you.
Great. Fantastic, great ideas, and many of you here on the tables actually have relate to this, no, with the work that you did. Group number 4 is this is a publisher for a comic book, and this was a specific request by the mental health group that they're working on a comic book. And we thought it's a good example for a private provider that we bring in. It could be an app provider, SIPA as an example, but I think you stick to the comic, no? Let us hear about what are challenges and what are solutions that you might propose. Yes, thank you.
Okay, our personnel here is a publisher and creative director, and he was engaged to provide or develop a comic book for African teens on mental health. So the key challenges and the pain points is that it has a series of questions which are really unclear, so it needs clarity on them. And then it includes the lack of implementation plans. He wants to know if it's a long or a short plan. And then funding inconsistent. It comes in fragments. And then feedback inconsistent from research teams, as well as lack of a clear defined terms, like I said earlier. So we identified the stakeholders that can help make this a success and gives us sustainability. So we identified the teachers, the parents, the teens themselves, and the researchers. And their roles include, for the teacher, is to facilitate access to the teens, and the parents are to give consent for intervention uptake. The teens are to co-create the intervention, and the researchers are to provide consistent feedbacks. Ultimately, all these stakeholders are needed for co-creating this intervention plan. And that the solutions is to engage all the stakeholders. Now, co-creation, to secure and disburse funds timely, and also to maintain sustainability of the project. Thank you.
Thank you. Great. So we should actually be involving also those that could help us implement it from the private sector, from the startup sector, involved very, very early. Great job done. Thanks a lot. Okay, we pass to our next stakeholder, which is school principal for nutrition intervention. What are you telling us?
Yeah, thank you very much. So for the persona, we have come up with a name, Ms. Veronica James, who is a female in Nigeria, and the school principal in this case saddled with the responsibility of providing administrative guidance and, according to the context, to collect data for the research, disseminate consent forms to the parents, as well as to schedule time for the intervention. The focus of this is nutrition intervention for adolescents. So, going through the context, we identified certain challenges this came with. We found out that there was non-involvement of the stakeholder, particularly the school principal, the educators, in the conceptualization and the planning of the intervention, because she still does not really understand certain points of the intervention. So at the point in time, she doesn't have the adequate information to address questions that may arise from parents regarding maybe ethical concerns or many questions they may have. She also lacks clarity on what the job description is, and as such, she's overwhelmed with too much responsibilities, as there is no clear chain of responsibilities on the intervention. Considering the schedule of the school and how the intervention is supposed to fit in the regular running of the school, there is also time constraints to accommodate the research. So when formulating such intervention, school schedule should also be considered to make sure that doesn't clash with the regular school activities. So to sustain the intervention, we mapped out certain stakeholders who would be very much involved in ensuring the intervention is executed as well as sustained. The school principals, educators themselves are stakeholders for this intervention because they are practically the linkage between the parents as well as the teen. And it's, as I've said earlier, important that we involve them in the conceptualization and the planning. We have the parents who are expected to provide informed consent for the adolescents, and they may refuse to participate because they do not have the understanding of the benefits of such intervention. So it's essential to communicate for their buy-in into whatever the intervention is. Also, the policy makers are basically expected to formulate policies that will accommodate addressing the health needs of adolescents in whatever policies is available. And it's also essential that you carry them along with the plans. We have the health officials who are supposed to pay visits to the school to deliver the intervention. Oftentimes, if they are not incentivized, they may not necessarily follow up with, because it's not part of their regular assigned task by the government, so to say. So the adolescents are also stakeholders because they are the sample population for the intervention. So what if they refuse to take tablets? In some of them, that age they can decide to make rash decisions. So we must find a way to explain in their language what the intervention is all about. Maybe by being creative with social media, creating cartoons, employing the media to find a way to reach them. So I think that's all for now. Thank you very much.
Fantastic. Thank you. Great. Great. So we have an adolescent table, so you should talk with them, with the adolescent table. We have the table number 6 is actually deserted. That was an NGO that works on, no? And actually, the one that was sitting there joined another strong group, which comes now as the group 7. This is the district public health officer. So this is the community. How do we involve the community? And I let you do table number 7.
So table number 7 talks about a health intervention, and the persona is Charlotte. She comes from Ghana. She's female, and she's a district nutrition officer in a rural community. And so her agenda then is to advance behavior change using SMS, and also conduct school visits in order to increase iron and folic acid supplementation. But her main challenges are issues about communication with the community. And so there is an issue about limited communication between she as an implementer or executor of the project, and then key stakeholders on the rationale, operationalization, and specific duties and roles. There are also issues about budgetary challenges and allocation. And so some of the main challenges we identified were resistance from the school principal and teachers about time allocation and changing schedules. We also found challenges with community health workers who are already overloaded with work, and so adding this to their work would be a challenge. We also found challenges that could arise from hesitation from parents on the side effects of such supplementation. And then even community members and then telecom companies about sending SMS messages to areas where network problems may exist. And so, as I list the problems, I've listed the key stakeholders. So for the parents, what did we try to do? maybe we'll start from the community in general. So we said that for such a project, it would be important to start an inception workshop engaging community members in total, because we see that different sectors of the community are going to be part of the project: teachers, parents, adolescents themselves. So this inception workshop is important because it will build consensus. We'll talk about the importance of the community owning the project, the personal importance of the project to community members. It may help with maternal and adolescent health issues. It may reduce the risk of anemia and improve adolescent health in general. We said that we will share success stories from other communities to boost their confidence in this project we are doing. We'll engage parents through parent-teacher associations. We'll share letters to parents for the adolescents who are in school, and for those who are not in school, we use community centers, which are common in rural areas, local community radio stations, to talk about this project and how successful it can become and its importance. And we also said that we will involve the adolescents themselves, because here they are the key stakeholders. We'll ask them about how they think about this project, the importance, how we should go about it, which times we should visit, and how the intervention should be executed. For community health workers, it became tricky because we know they're already overloaded, but we said that they could include this work in their other routine visits. So while they go for other routine visits, especially for out-of-school children, they will carry their supplementations with them. They also said that we are going to enhance their training on the importance of the supplementation. And we recognize community health nurses or workers who meet their supplementation targets, because we know that monetary incentives may not be sustainable over time. For teachers and school principals, we said we will enhance their understanding of the importance of supplementation so they can make allocations or schedule allocations to accommodate the school visits. And then we also have community leaders who will engage throughout the whole project. Thank you.
So here we have seen it at the national level with the minister, but then at the community level, the community leader, how important it is to bring the stakeholders together. So I think we had some very nice ideas, and I hope also the exchange of ideas has been interesting for you to maybe take some ideas home and connect later on those ideas we have put on. Okay, 3 more to go, and then we're done. Now we have very interesting 3 stakeholders coming up, and we will start with the adolescent group number 8. So give us how do we evolve, what is the interest of the adolescent group?
Thank you. In our group, we are dealing with a 19-year-old girl called Rosenmöller. She's a youth leader and a national coordinator of student-led gender equality movement. She's also a member of the Arise Advisory Board, and her main activities that she does in these groups or in this work, she was involved in co-developing the sexual and reproductive health interventions for adolescent girls. Mainly, she helped in shaping the messages around the use of sanitary pads and choosing delivery methods, and in advising the design of these pads. And she really felt so good about it. And the main component, the main focus of this activity, as I've mentioned before, is menstrual hygiene interventions. So the main challenge that this group thinks that this youth leader was facing is assumptions, because the thing is, when the project entered into implementation stage, she was not involved. She has been involved in co-developing, shaping messages, and here, when it is implementation, they are designing budget and logistics, she was not involved, and she was very scared and not happy about it. So we feel like she had assumptions that she will be involved up to this stage past the first stage, developing, designing, and into implementation. So we also feel strongly that this challenge could be solved by having clear communication from the beginning of letting her know that you will move up to this point, and from this point you won't move. If there was if she was well informed that her scope of work will be up to where she can reach, then she wouldn't feel that she's being excluded. So from her side, she feels used, and she feels like she was just a symbol of reaching, shaping messages, communicating to other girls, but she has not gone up to implementation. So we feel that as they progress into other activities, then there should be a clear communication. There should be a memorandum of understanding from the beginning that when you come on board, this is what you will do. So that she does not feel bad, and the people who she's working with, they are also not seen as villains, like you are using this girl, you're not involving her in all that kind of bad feelings. Thank you.
Thank you. Oh, no, she has to talk about it. Okay.
Yeah, that was an issue, and actually we discussed a lot about the role of adolescents in the further steps of our project. So we think the government officials, they are part of the stakeholders. They need to have clear communication from the beginning about the role of each participant, but also they should be also open to be criticized that they use, because they might have something important to add to their decisions that they are not seeing. Sorry. And in my opinion, because we are not fully agreeing.
I see. Very good. This is real life.
Because, for example, we discussed about budgeting, what does an adolescent has to do with budgeting. But I think if you are creating projects for adolescents, and you decide, okay, we are going to spend all the money on here because we don't have much, and this is like the most efficient way, then you might be missing something important, and when you start implementing your strategy, it couldn't work at all. It could be a waste of money because they are not using it because you forgot to include their opinions. This could happen, and this happens in other instances. So I think the role of the adolescents in this case, they have to be part of the decision making, maybe not in the full discussion, but once the government officials have done their decision, they can have like a one last chance to give their opinion and say, yeah, this could work, or this could be improved. Just a small, but they should be more heard. About the other stakeholders, like the NGOs and the school administrators, they also could support this role of adolescents. They could be a source of voice, because they are too young, so this could happen that they are not really listened, they are left out. So the NGOs and the school administrators have the role to remind the government, hey, they are here, they have an opinion.
Very good. Very good. Thank you. So I really like that this challenging work with adolescents in their role. Go ahead.
Thank you. For Group 9, we had a case where a chairperson actually, by name Sarah Lucia, she's a female from Kenya and also a nurse. She's deeply committed to improving school health outcomes. She was encouraged to learn that her daughter's school is part of a big program co-designed with adolescents to promote menstrual hygiene by distributing reusable menstrual pads and delivering supportive educational models on menstrual health. So in this case, we identified some key challenges and main points. The chairperson thinks that the program is a good thing, but does not understand and does not feel her voice has been has seen hand. So as the parents were not involved in the program design or informed of it. Also, once she raised concern, she has not received a response. So the program intends to scale up, but there are concerns parents and community members are not included. Unsure if it aligns with culture and values or if it is culturally appropriate. So in this case, we identified some key stakeholders, which includes the parent network or the parents of the children. We also identified the community health workers. We also identified the religious or cultural leaders, and also the district office and also school staff. So in this case, the solutions we were able to profile to address this challenge. Through the chairperson, Sarah, the PCA will reach out to teachers to share positivity towards program or voice questions or concern on behalf of the parents. Also, there can be requests that teachers support informative assessments such as FGDs and key informative interviews with parents, community, our religious leaders, other school staff, etc. Teachers to share feedback with stakeholders. Also, there could be a share feedback with district office to request co-redesign of the interventions. Also, request for a similar formative exercise in other regions. Thank you.
Wonderful, great job. I would have loved to sit on your table to discuss with you. We have seen some very great experiences of parents being actively involved in research design and in the learning from that, and then naturally also in the take-up. So, good job, well done. Thanks a lot. Wow. Last but not least, we're nearly there. The other group just finished, so let's concentrate another few minutes and let's talk to the media. Like, what is the media? What are their interests? How can we catch their attention if we want to? Or how would they like to see the collaboration with the academics? Group, last but not least, group number 10.
Group 10. So for the media, that had a focus on media and SRH coverage issues. We had a journalist, a female journalist coming from Uganda called Mary Dash. She actually focused on sexual and reproductive health issues in terms of her reporting area. Mary's main activity has to do with reporting on adolescent issues within her community, conducting interviews with adolescent girls, empowering youth, and also framing stories around drug abuse. Her main focus and components includes media engagement in sexual and reproductive health, communication strategy for menstrual hygiene, or menstrual hygiene, youth empowerment and voice amplification in the public discourse. Also advocates for adolescent girls and boys, especially in terms of their rights. The other areas that she focused on, looking at the story, she's actually passionate, Mary is passionate about the rights of the girls to ensure that their rights are not abused, and she ensures that there is a bridge between sexual initiative and the wider public in terms of their knowledge. And she's also passionate about using evidence to inform the population. And she's also passionate about inclusivity of adolescent girls and boys on sexual and reproductive health reported issues. What are some of the key challenges going through the story? The key challenges that we actually identified and point out in a way that the first one, we realized that she didn't have clear communication guidelines, and so she had a backlash with the community members. She also lacked an updated information from the media space in terms of information, updated information from the academia, updated information from the Ministry of Health. She didn't have this information, accurate information to be able to communicate to the adolescents and also the public in general when it comes to sexual and reproductive health. The project that she was also coordinating had no media engagement strategy, had no adherence to manufacturing practices because looking at the story, there was an issue about reuse of pad, sanitary pad for adolescent girls. Now, some stakeholders that we identified during the process of for her to be able to work with and also looking at their role. The first one is adolescent girl. And one of their the role that we outlined for adolescent girl on this project is to, once she's able to identify these adolescent girls, she'll be able to educate, the adolescent girls will be able to educate their peers when they are influenced well. But the key challenge here with working with adolescents is the concern about the infection, the concern about the stigma, the embarrassment from the society if she intends to use these adolescent girls. And also the media association. We also identified the media association as one of the key stakeholders for Mary because she's a journalist. And within the media too, they also normally have regulations. And so if her association is not updated to be able to inform the members about SRA issues, then she will also have some of these pieces of information, and that would be one of the challenges. The Ministry of Health also, in terms of their role, was to provide policy directive and ensure standard for reporting in the media. And we also realized that one of the challenges the Ministry of Health she may have or might have is the bureaucratic delays in terms of approving some of the information. I will not mention. Okay, so the remaining stakeholders are teachers, manufacturers, parents, and the Ministry of Education. I will not mention that.
Yeah, but we did give a few bullet points on the solutions of what we could do about it. I mean, you did work on your story very well. I really recognize that.
Okay, so the proposed innovative practices that we brought together is the first one is to have a co-creation intervention to be able to address some of these challenges, especially designing specific training needs for each of these stakeholders that we have enumerated above, and to also ensure that good manufacturing standards and practices are adhered to within the manufacturing space. And the third one is also to develop multi-sectoral approach for these challenges that Mary faces as a journalist. So our last point, in terms of transferring some of this knowledge from one country to the other, the first one we look at is resource availability, which is a potential issue. The opportunity here is that we may have a potential of leveraging on the global supply chain, especially with the manufacturing space. And the anticipated challenge here is the resource constraints, especially when it comes to financial and human resource material. And we may have some limitations in terms of the country regulations when we are scaling to another country. The second one we look at is the model that we want to transfer into another country. The opportunity here is that we are likely to design a co-peer network so that the other country who are interested will come and learn from what we're doing. But the challenge here is that we may also have some national regulations that may impede the scale at which we want this innovation to be scaled to other countries. So,
and can the media help there in order to do this transfer?
Yes, the media in that country can also do that. And we've indicated the media association. And so once we are going in there, the first stakeholder we need to engage is the media association within that group to be able to create this.
So there could be that she has a fantastic network that could be used, no? They're saying, oh yeah, I call up my colleague in the other country. So that's something, a good opportunity. Well done. A big clap of hands for our last presenter. So, wow, fantastic ideas that came out. I think we have seen here the aim of the exercise was really to putting us in the shoes of the different stakeholders, so that we think like what would be interesting for them, and then we go back and look into our scaling project, etc. And I think I just try to take up some of the ideas that you have put forward here. We will put them together, we will try to make a bit sense of it, and then maybe together I'm just moving forward to the last one, because there's this nice, Laetitia made those slides, this nice action point. Because we would like to see that in our project, with the different interventions we do, what type of real actions can we take, what are the stakeholders that are involved, so that will be in the Horizon, also in the Dutch project, will be a task that we have to do together, particularly with the researchers on the ground that knows very well these stakeholders. So this exercise was also a bit about a first exercise on how can we go about this later. And what I also like that you kind of exchange ideas across countries, so take advantage of that. If you, of this particular part, said, oh, you do a great job there, can you tell us how you do that? So I think I really enjoyed this exercise. I would have loved to sit on each of the tables and listen to what you said, and I hope it has been interesting for you. Before we close, I would like to thank all of you. You stayed long, you worked hard, you provided a lot of creative and interesting ideas. So we do, as she said this morning, we will give a big clap of hands to all of us. And then I would like to have a special thank to the different working groups that helped us, that took time, that gave us the ideas, etc. And then also a big thank to the team, to Laetitia, who has put a lot of work into that, and also Tima. Tima did the case studies, so I think he did it. Okay, this will be the end of, at least of this workshop, not the end of stakeholder involvement. We will get back to you with ideas, and we're happy that you come forward and tell us about what you do and what could be ideas that we could take forward in the team. We have been working closely with Burkina Faso, so that's actually what we know best in terms of uptake. But we will reach out to you in the different groups on ideas on how to go about. We will call it a day for today, but before I let you go, I have someone that would like to give you a few ideas of what we do tomorrow. So from my side, have a nice evening. I look forward to the fantastic presentation that we will have tomorrow. So we will see tomorrow here at 8. Oh, you will know. Joy, thank you.
Big hand clap to Laetitia. Thank you. So tomorrow is our day 3. We start off with the oral presentations in the 3 rooms, Africa, Asia, and America. And then in the afternoon, we are going to launch the special thematic working group. So last year, we launched the think tank, and now we are launching the driving engine. So thank you very much for being energetic. 7:30 is registration, and at 8 we start with the oral presentations. 8:30 to 8 to 12:30 we have the oral presentations. We go for lunch, and then 1:30 we come back for the launch of the special thematic working groups upstairs, Africa, America, and Asia rooms. Thank you so much.
Thank you.